Good morning. Thank you all for joining us for the 29th Annual Motorola Solutions Foundation Excellence in Public Service Awards, presented by the Civic Federation. We are very excited to honor two public servants who might be the most well-known honorees in the history of the award, or at least the honorees who have had more time on camera than any others. Both Illinois Department of Public Health Director Dr. Ngozi Ezike and Chicago Department of Public Health Commissioner Dr. Allison Arwady were unanimously selected from a most impressive list of nominees as this year's recipients by our independent advisory committee. We look forward to celebrating their many accomplishments this morning. In just a few moments, you will hear from the chair of the Civic Federation Board of Directors, Monica Mueller. But first, I'd like to extend the Federation's thanks to all of our sponsors and participants for today's program, including our past recipients and other individuals who serve as our honorary co-chairs and members of our advisory committee. A full listing of our sponsors, advisory committee members, and honorary co-chairs, as well as all past honorees, can be found in the program's landing page and in our slideshow. If you missed the pre-program slides, stay tuned after the program for a rebroadcast. Also on the landing page, you'll find information about how to order our special commemorative masks, if you have not already done so. Many thanks to all of you. I'd also like to express special thanks to the public officials, Governor Pritzker, Mayor Lightfoot, and Cook County Board President Tony Preckwinkle, as well as all the healthcare workers and first responders who are tuning in this morning, amid one of the most difficult years that many of us have ever known. You have shown great courage, all the while providing us with essential guidance, services, and most of all, hope. We look forward to honoring your public service in person soon. Thank you again to everyone for joining us. Your presence and participation are a wonderful tribute to the high regard in which you hold Dr. Ezike and Dr. Arwady and the work of all of our public servants. Now it is my pleasure to welcome Civic Federation Chair and longtime public servant from a previous life, Monica Mueller.
Thank you, Lawrence. Good morning and welcome again to the 29th Annual Motorola Solutions Foundation Excellence in Public Service Awards celebration, presented and administered by the Civic Federation. We are so pleased to have you all joining us virtually today. My name is Monica Mueller, and I have the pleasure of serving as the chairperson of the Civic Federation's Board of Directors. It is our great pleasure this morning to recognize Dr. Ngozi Ezike, Director of the Illinois Department of Public Health, and Dr. Allison Arwady, Commissioner of the Chicago Department of Public Health, for their exceptional contributions to public service, especially over the past year. For only the second time in 29 years, our independent advisory committee has unanimously chosen to honor two equally deserving public servants. I think you'll agree that each of their commitments to public health, safety, and compassionate leadership merit this recognition. Soon we will hear much more about Dr. Ezike and Dr. Arwady's very impressive careers. But first, it is my pleasure to welcome and recognize one of my colleagues and friends, Cynthia Yazzie of Motorola Solutions, who will present both of this year's Excellence in Public Service Awards. Cynthia has been with the company for more than 2 decades. She currently serves as the Senior Vice President and Chief of Staff for the Chairman and CEO of Motorola Solutions. Cynthia also leads worldwide marketing and communication efforts for both Motorola Solutions and their foundation. She previously led product and business operations for the Asia-Pac and Middle East regions, among many other roles at the company. Cynthia is a graduate of Concordia University in Montreal, Quebec, with a degree in engineering. She currently serves on the board of directors of the Red Cross of Greater Chicago. We are very honored that she could join us virtually to introduce our recipients. Please join me in welcoming Cynthia Yazzie.
Good morning, everyone, and thank you, Monica, for the introduction. Today, I'm coming to you from a museum exhibit that celebrates the contributions of women in medicine. How appropriate. The Motorola Solutions Foundation is a proud, long-term supporter of today's event, and it's an absolute honor for me to introduce today's impressive award recipients. Created almost 3 decades ago, the Excellence in Public Service Award consistently recognizes the hard work of non-elected public servants who are responsible for implementing policy that has made an exceptional impact on the quality of Illinois government services. And despite these passionate efforts that go into shaping and strengthening our communities, This important work, unfortunately, often goes unrecognized. And now, more than ever, due to the COVID-19 pandemic, the need for public service is critical, especially in public health. But today, these efforts will not go unrecognized, because today we are here to recognize those who have gone above and beyond. And this year's award will honor not only one, but two incredible public servants. Only the second time we've done this in the award's 29-year history. Our recipients are two of the finest public health leaders in Illinois, two extraordinary women who, despite facing unprecedented challenges this year, met each and every hurdle with an unwavering dedication, perseverance, and tenacity. And their tireless efforts have no doubt seen Illinois through some of its darkest days. So without further ado, I am very proud to announce this year's honorees. Dr. Ezike, Director of the Illinois Department of Public Health, and Dr. Arwudi, Commissioner of the Chicago Department of Public Health. Dr. Ezike has spent many years in public health in Illinois, and when we needed confidence and transparency this year, she delivered, playing an invaluable role in the daily COVID press conferences, delivering easy-to-understand updates in both English and Spanish. Her leadership, her warmth, and her inclusivity have provided reassurance and a much-needed reprieve from pandemic-related anxiety. Thank you, Dr. Ezike. And for her part, Dr. Arwudi, another Chicagoland leader, has dedicated her entire career in disease identification, prevention, and control, including important work on the Ebola and Middle East respiratory syndrome outbreaks. It's this lifelong experience that's culminated in her exceptional leadership of the Chicago Department of Public Health during the COVID-19 pandemic, where she has served as a vital source of information and pragmatism for you and I, Chicago residents. Now, this is only a snapshot of what these two determined women have accomplished as public health servants. Their work, their expertise, their role has played a pivotal role in our city and state's response to COVID-19, and their lifelong dedication to improving the health of our communities is truly helping make Illinois a better, safer place to live. In the next few minutes, we'll hear from others as they reflect on the countless contributions and accomplishments of our two impressive award recipients. First up, Dr. Ezike.
Dr. Ezike is a unique person. She is a holistic person. That's apparent when you deal with her.
The last time the country faced this kind of health crisis was 100 years ago. We're really grateful for the help and support we've gotten from the Illinois Department of Public Health under her leadership.
I have the utmost respect for her, and Dr. Ezike, I think, has really stood tall in this incredibly difficult moment.
She's somebody who has a history not only to public service, but also to dealing with really enormous problems that could face our public health systems, and boy, did she run into one.
I started my medical training here in Chicago at Rush Medical Center, and from there went to Cook County Health, formerly Stroger Hospital, and from there to the Juvenile Temporary Detention Center, and then finally to IDPH. When I think about what that experience has given me, being able to know what it's like to be in corrections, those congregate settings, and how that plays into infection control and pandemics. I think since I was very, very young, the story that my late father tells me is that he had to take me to the pediatrician. The doctor was like, I never saw a kid walk at 7 months. I think that means that she's gonna be very bright and very athletic. And so my dad only heard the bright part, and I think decided right then that he was gonna have the first doctor in the family ever, and really was set on that. I went to college and liked everything and said, well, I don't know. I think law seems really cool, and I love languages. Maybe I could do something with that. So I took my first Spanish class in college, but I ended up landing on medicine and really have never looked back. Ha sido un año largo y difícil, pero el final está cerca y a la vista.
One of the things that impresses me is she's a fluent Spanish speaker, and she always, at her press conferences, she always speaks in English and then goes into fluent Spanish. I mean, it's pretty impressive.
Isn't that amazing? Now, that may seem small to people. It's not. It means not only are you sensitive to the issue, you work hard enough to make sure that people who have English as a second language can understand it and get the message. So even that speaks to her sensitivity.
And Dr. Ezike is a pediatrician, and I think her focus on children and families is something she's brought to her present job, and that's been the lens through which she sees her work.
She's compassionate. She cares deeply about the work that she's doing and about the people that she's doing it for. And then she's managed to do that from a podium, talking to the 12.5 million people of the state of Illinois in one of the deepest crises we've ever seen.
The challenges that we face in Chicago are obviously magnified across a very, very diverse state that has a different landscape, different needs, different concerns. I thank her for her leadership. I also thank her for incredible partnership with the city and in particularly with our Department of Public Health.
Team IDPH has gone above and beyond. We are a relatively small, understaffed, underfunded state health department, and we just have really risen to the challenge. It's been the honor of my career to have this position, even at this time, and I'm so grateful for the governor for entrusting me with this role, and it's been an honor working with him through this pandemic. Dr. Arwady is an amazing public health leader. We talk multiple times a week. I would love to thank my wonderful husband who has taken on many of the roles that were traditionally mine and has not complained not one single day. I am so honored and grateful to the Civic Federation for this tremendous honor.
I'd like to thank Dr. Ezike and the team at the Illinois Department of Public Health and congratulate her. Good job.
Wow, this is tremendous. You deserve it.
Congratulations, Dr. Ezike.
It's Dr. Ezike that I have relied upon, no doubt Dr. Arwady that Mayor Lightfoot has relied upon, and I think the people of Illinois should be so proud of these two Illinoisans.
It is my absolute honor and privilege to congratulate Dr. Ezike, co-recipient of the 2020 Motorola Solutions Foundation Excellence in Public Service Award, and welcome her to say a few words.
To President Lawrence Masal, the board and membership of the Civic Federation, thank you for this outstanding honor of being awarded the Motorola Solutions Foundation Excellence in Public Service Award. I am overwhelmingly humbled by the recognition, primarily because as I see it, I'm simply doing what I was called to do. And as I tell my kids, I'm not going to pay you to make your bed, to do the dishes, take out the trash. You're expected to do that. So I am proud to do what's expected of me. Moreover, any perceived success or achievement is the result of the incredible, dedicated, driven, selfless, talented team of people that I call my IDPH family. It's absolutely a privilege to work for and lead this amazing agency. Team IDPH's passion for serving the people of Illinois is what keeps me motivated each and every day. In addition to the Civic Federation and my team, I have to express my gratitude to Governor J.B. Pritzker for his trust and confidence in selecting me to serve our state as its health director, and for keeping me, and for sharing with me this opportunity to help advance his crystal clear vision for making our land of Lincoln the best it can possibly be for each and every resident. There's another team that I absolutely want to take a moment to publicly thank, and they are the behind-the-scenes crew who were drawn into this job about 2 years ago, and then the pandemic 1 year ago, and they didn't have the option of saying no or backing out. Well, I take that back. One kid did try to run away. She staged it as a kidnapping complete with a ransom note, but that's totally a different story. To my husband of 20 years and my 4 children, you have filled the gaps when mom was working extremely late hours and couldn't be there, tolerated my drafting them into IT service when my WebEx or Zoom calls kept dropping, and turned off, however begrudgingly, their Wi-Fi to ensure I had a strong signal. To Team Ezike, I thank you for being that force that loves me into becoming a better version of myself. You are my heart. It's one of those ironic twists of fate that public health professionals typically work behind the scenes, outside of cameras and spotlights, until a problem arises. It's our work in battling HIV and other STIs, lead poisoning, plagues, food outbreaks, and now this pandemic that causes us to be drawn into the limelight. But to the hundreds of thousands of researchers, epidemiologists, clinicians, statisticians, and all the professionals who have dedicated their life's work to protecting our health and wellness, I say thank you. You too are true public service heroes who work tirelessly to make this world safer, and we owe you a debt of gratitude that we will never be able to repay. As I inferred at the start, the work upon which this award is presented is, of course, not the efforts expended by the awkwardly lanky, shy, but curious 13-year-old from Los Angeles who had thoughts of becoming a doctor. It is the collective effort of some amazing people working to fulfill the dreams of 12.7 million Illinoisans who deserve to live a happy, safe, healthy, and productive life. We are helping them reach that full potential. And so on behalf of all those dedicated behind-the-scenes professionals at IDPH, that I accept this award with humility and gratitude and with a pledge to continue serving. Thank you, and as always, mask up, wash up, back up, and vax up for the health and safety of our lives and communities.
Thank you, Dr. Ezike. Now let's hear from others as they reflect on Dr. Arwudi and her outstanding accomplishments.
When I think of Allison, I think of someone who is incredibly dedicated, who is persistent in knowing what needs to be done, but open to input on better ways to get it done.
You know, she has a lot of energy. She has a zest for life, and she's engaging. When you're around people like that, they're people.
The first voice I hear outside of my wife in the morning is Dr. Arwudi. I just think that for me has been an incredible comfort, an incredible support. She has been such an incredible champion during this most uncertain time. I think it's one of the best appointments that I have made.
I was not pre-med when I was in college. Nobody in my family growing up was in medicine. I loved science. I was a history and literature major, to be honest. I took an intro to epidemiology class that I knew very little about. I sort of took it for fun. And it was like, this is what I want to do. Because it was like this science of not just disease, but this science of how disease spreads, and then recognizing that how disease spreads is a little bit about biology and a lot about social context. Before the Chicago Department of Public Health, I was at the Illinois Department of Public Health as a CDC assignee. And actually the first time I had been with CDC was in Botswana. I knew that even within public health, I was really interested in getting outbreak training, and I was really interested in international work. It's kind of crazy for like the thing you want to work on in like all the world to be outbreaks and to be doing this job, but it is the thing that I am the best trained for. So never ever would I have wanted this to happen. Obviously in Chicago, in the US and the world, I do feel reasonably lucky to have been well trained to at least have some experience at some level in a number of the different aspects that we've had.
I spent a lot of time thinking about public health before I became mayor. So I appointed her first as the acting commissioner. Over the course of several months of engaging with her, talking to her about why public health was so critically important, I just became very impressed with her that she was the right leader. Little did I know how important her background and experience would be as we got into the pandemic.
Saying that she's the right person at the right time captures it completely. And one of the things that I think is important, Dr. Arwudi is committed to communication to everybody. She made it very clear from the very beginning that she was doing these Facebook Live events and giving an opportunity for anybody who wanted to just call and ask her a question directly. And that is a kind of access that you seldom see.
She is board certified in both medicine and in pediatrics. So she's an excellent academician, but she also, she has that community touch. She understands people and how people have to deal with issues in real life.
And she has become kind of a celebrity in her own right, and rightfully so. We wanted to be transparent and hold hands with our residents through this very difficult time. And Dr. Arwady, I think, has done just that. She is the doctor in the house, and people love and respect her and listen to her advice on a range of different issues, and me too.
I've been so grateful here to work for Mayor Lightfoot. My mom and my dad, I've got 3 siblings, all of whom talk to me a lot. I definitely want to thank Dr. Ezike, and I certainly, we talk a lot. My team here has just been, amazing, and I really can't thank people enough for that.
Congratulations, you deserve this honor and much more. Thank you for all that you do, that you're going to do for Chicago.
It's a monumental award, and it couldn't have gone to a better person.
I can't think of anyone who is more deserving. Congratulations, well deserved.
It is my distinct pleasure to congratulate and introduce our second co-recipient of the 2020 Motorola Solutions Foundation Excellence in Public Service Award, Dr. Arwady, and welcome her to say a few words.
Thank you for this wonderful honor. I'm grateful to Motorola Solutions and the Civic Federation for this award, and seeing the list of recipients over the past almost 30 years, very humbled as well. I also want to recognize Dr. Ngozi Ezike for her well-earned honor. We've been partners throughout this pandemic response, and while it hasn't always been easy, she's been steady, smart, and committed in her role as the state's public health leader. Illinois is lucky to have her. The COVID-19 pandemic has been a huge challenge for our city and for me, and I have to recognize the amazing staff at the Chicago Department of Public Health that have been working tirelessly for a year now to stem the spread of virus and protect our city, and particularly the most vulnerable neighborhoods and people. I accept this honor today on behalf of them. I also want to recognize Mayor Lori Lightfoot and thank her for her leadership throughout this crisis. I can tell you that she has been deeply engaged from the very beginning in our response, a partner every single day, asking questions and pushing for solutions during what have sometimes been difficult days. I'm grateful she's leading our city during this challenging time. And as I look ahead and really think about the lessons that we've learned from COVID, I'm so excited to take the new opportunities for public health, the new voice that we have, the new platform, and the new attention that we as a city are paying to equity. I think this challenges us not just to respond to the pandemic, but to think about how to take these lessons and bring them forward, how to create a healthier Chicago for all, and recognize that that won't happen by accident. I'm excited to take the things that we have learned so far, keep building on them, and keep growing, and we will end up in a better place at the other end of this pandemic. Thank you.
Dr. Arwady and Dr. Ezike, congratulations again on this well-deserved honor. On behalf of all of us at Motorola Solutions, know that we stand with you in the continued fight against COVID-19, and thank you for all that you do. Monica and Lawrence, back to you.
Congratulations, Dr. Ezike and Dr. Arwady. What a fitting tribute to your respective careers and exceptional public service. We hope you enjoy your well-deserved awards. The awards this year are a framed print from the World's Fair of 1893 that was held in Chicago. For our viewers, more information about each award is available in the post-event slideshow. Now it's my great pleasure to introduce our keynote panel, featuring Dr. Ezike, Dr. Arwady, and led by Dr. Julie Morita, who, like our honorees, has had a very distinguished career in public health. Dr. Morita currently serves as Executive Vice President for the Robert Wood Johnson Foundation, where she oversees programming, policy research, and communications activities. Previously, Dr. Morita served in leadership at the Chicago Department of Public Health for more than 2 decades. As Chief Medical Officer in 2014, she led the city and the department through the U.S. Ebola outbreak. In 2015, she became commissioner. Among Dr. Morita's many professional and civic affiliations, she began her career as a pediatrician, has worked at the Center for Disease Control, and is a member of the American Academy of Pediatrics and the board of directors of the National Foundation for Infectious Diseases. We very much look forward to this discussion among Dr. Morita and our honorees, who are unlikely to need any additional introductions at this point in the program.
Thank you for the warm introduction, Lawrence. It's really an honor to be able to join the Civic Federation in your celebration of Dr. Ngozi Ezike's and Dr. Allison Arwadi's heroic efforts in leading Illinois and Chicago responses to the COVID-19 pandemic. I cannot think of 2 more deserving recipients of the Excellence in Public Service Awards. Allison and Ngozi, this has been the largest and most prolonged public health emergency of our lifetimes. It'd be great to hear from you about your experiences leading the state's and the city's response. I'm going to start off with a question, a simple question, and then maybe lead into a more difficult question. How long were you serving in your current roles before the coronavirus became widespread? And how did your prior experiences prepare you for this crisis?
I was serving in the role for about a year before this situation really unfolded, and I'm grateful to have had that year where I was clear on who my staff was and the different agencies and who we had as partners, and had worked very closely with the different local health departments across the state. So it definitely, I had some grounding before this incredible journey began.
So I was confirmed by the City Council into the commissioner role 4 days before the Chicago Department of Public Health activated for our COVID response. So I had 4 COVID-free days in the commissioner role. But prior to that, I had been serving in the acting role for about 6 months, and I had been the chief medical officer at the Chicago Department of Public Health for about 5 years before that, and then previously was with the Illinois Department of Public Health assigned there from the CDC. So I had had a lot of experience working in public health and in different settings, but certainly being in this role, I have really had only 4 days that were not taken up by COVID in this role.
That's truly amazing for both of you, just in your positions for such a short period of time. So based on your past experience, are there some key lessons that you've learned from the pandemic that you'd want to share with the audience? Maybe Allison, you could start off first.
Sure. I mean, the thing that I've always learned is that it doesn't matter whether it is a very small foodborne outbreak or it is a global pandemic. The way we approach it is really the same, and the things that go well and the things that don't go well are often the same. And so, I always think about the 4 C's. I think about the cases themselves, which is the hospitals and how are we caring for cases and everything about that. I think about the control of it and sort of all of the containment and the contact tracing and all of the work of public health. That's what most people imagine, but then the 2 places where we tend to have to focus the most and are more behind the scenes are the coordination piece and then the communication piece. And it is coordination and communication that are not the things people think about, but they're the things that make an outbreak response really go well, or otherwise, places that you got to work on when things are foundering a little. And so I've really come back to those over and over and over again. And usually when we're having an issue in a given week or in a given month, it has to do because one of those 4, and it's usually coordination or communication. We just need to tighten it up a little bit.
Yeah, I think that's well said. You could add the 5th C of collaboration, which again falls in with what she's talking about. We have so many stakeholders in this that go beyond the public health agencies, the local health departments or the state health agency. And so identifying all of those partners and making sure that the collaboration goes across all the different groups, where the hospitals, the actual residents of the jurisdictions that we're looking at, we have other state agencies that have important roles. There are just so many stakeholders, the community-based organizations, making sure that every one of those stakeholders is brought to the table and has their part clearly identified, and that we're all working together with the communication and the coordination, that's really been a very important piece as well.
That's great. Thanks for sharing those insights with us. I think, as you pointed out, these are things that you use both during outbreaks, but also just in day-to-day public health type of activities. They're critical. So as you reflect back upon the past year, what has been the biggest surprise for you? Something you weren't expecting as you've been dealing with this pandemic? And Ngozi, maybe you can start.
I mean, I think, and probably Allison will agree, it's just how science became political, and how this became, facts became pawns in some political issues, which has really hurt the well-being of people, has caused, I think, more harm, more hospitalizations and deaths than we probably needed to have. I think we really, as a leader in the world, could have set a much better example, so that we could have been at a better place than where we are right now. So, I know pandemics and politics obviously don't mix, and so we'll have to make a very concerted effort to make sure that some of the lessons that we've learned, that we really do learn them and are ready to do, a slightly better job than maybe what we started with for this really significant pandemic.
Yeah, and I think I would certainly echo that in the ways in which I think largely we've done a pretty good job here at the city and the state level of trying to keep the politics really out of those decisions. And I think, both of us work for leaders who have wanted to listen to the science and listen to the public health and really be collaborative in those decisions. But it's interesting to be in the middle of making public health decisions that have such major, economic and other implications. And I think, one other thing that just has surprised me is that even though there have been parts of this that have been very unpredictable, where we learn new things about the virus, that continues to happen. At the end of the day, success in this does come down to having those core public health things well supported and in place. And so places where I think we had good investment as a city, as a state, as a country have gone very well. Some settings that we've not invested in as much, whether that's the technology piece, whether that's some of the laboratory surveillance piece, even some of the staffing pieces, frankly, where we've seen such major cuts to public health over the last 2 decades. It was interesting to see quite often that we knew what needed to be done, but then not always having the resources to turn that very good plans and expertise into success. And so, I'm really hopeful that there has now been significant funding that's been directed to public health as the result of the pandemic. And, we're both trying to think about how to use that funding, not just to get through COVID, but to build a much stronger public health system. Because I think everybody has sort of come to the recognition that public health is not the same as medical care, and the work that we need to do to make sure that we're protected as a society, and we're doing that kind of work. So it really does come down to, in a lot of cases, the spaces where we were kind of well-funded and well-prepared versus the ones that maybe were just not prioritized over the last couple of decades.
So we're hoping that infrastructure that we will look forward to building stronger roots in will be something that we will be able to have it grow, and not have it as soon as COVID's in the rearview mirror, then those funds get yanked away. We don't want the just-in-time public health, structures. We need them to be there so that we can actually anticipate and be more prepared for the next situation.
Yeah, and I think, we've also just the inequities, right, in the city and at the state level that pre-existed, that, certainly at the Chicago Department of Public Health had been our focus already, how much those have been highlighted in the time of COVID, and that it's just highlighted. We have a lot of work to do, as a society, as a city, and this outbreak has highlighted where we have cracks, where we are not thinking about how to create a strong society where people are able to do the basics, like stay home when they're sick, have family leave. Like, what have we, do we have safe settings with, good ventilation? Like, how do we think about sort of creating healthier structures that will outlive COVID? So it's a lot of things, but.
Yeah, you bring up great points in terms of the politicization of the outbreak, the lack of stable, consistent funding for public health, and also the equity, how equity has really arisen as a major issue, and clearly the need for additional work is there. So those are great examples. I guess I'd like to move on a little bit and talk a little bit about the vaccine. So a couple of questions for you related to the vaccine. Can you talk about some of the challenges that you experienced with the rollout of the vaccine program? And then also what you think the public should expect when everyone is vaccinated. What will life look like once everyone is vaccinated?
Well, yes, it's been quite a journey at this stage with the vaccine. Of course, we're so delighted to be at this stage where we are dealing with not one, but two very safe and effective vaccines, which are an important part of, dampening down on this virus. So, of course, we know that there are supply chain issues. I think we have many people that are really on board and willing to take this vaccine. And we don't have quite enough for all the people who are eligible and ready to take it. And so, the waiting game that we're asking people to be patient and wait as we continue to get the trickle of vaccine into the state each week. I think it's a hard thing to ask of people who have been doing so much of the waiting and the delaying of personal and community things in response to this pandemic, and now they're so close, but there's still more and more waiting. I think better days are obviously around the corner, even as we think about these variants that are looming. And we are excited to be working with the administration as we, look forward to increased, supply, increased production of more vaccines, hopefully new vaccines, to make that delta between the people who want the vaccine and our available supply as we watch that narrow.
Yeah, I would say, boy, what an achievement to have gotten these vaccines, safe, effective vaccines, all of that investment and work on the biomedical side, really amazing. But unfortunately, there was not that same sort of forethought and investment in the actual public health side of turning vaccines into vaccinations, that work to get them into arms. And we are just now starting to get some real funding flowing, honestly, that we have plans for, and we have lots of ideas about how to use. So I'm glad, again, that there is now some real funding coming, because I think people don't always recognize that the work of public health does take work also, and does take real investment. And I think where we've seen this stutter across the country also points to just the fact that we don't have anything approximating a national health system. And even forgetting a national health system, we don't have a health system with computers that talk to each other. We literally have electronic health records that are designed to be competitive. And when you're trying to do something like vaccinate a city, a state, a country, we're doing a lot of Band-Aids on top of a system that is not meant to be communicative. And so I'm hopeful that with the new administration, in addition to a major commitment to ramping up production of vaccine, giving us more of a runway so that we're learning more than a few days in advance how much vaccine we're getting, lets us then plan even better sort of at the state and local level what that will look like rolling out. But I do think also things like major investments in public health informatics just need to come, because we're all doing the best we can with the tools we have, but they're not sufficient, I think, just honestly. And so I'm hopeful that that's something that we'll continue to see really get better at the national level. And when I think about sort of what are things going to be post-COVID, I mean, this is my crystal ball where everybody always wants to know when is this, when can I go on my vacation, when can I take my mask off? And, we are 1 year into the 2 year
relationship.
We are right at the beginning now of really the time with vaccine. I do think actually broadly it's going well in terms of the rollout. And as we see more and more of the population getting vaccinated, we do expect there to be lower levels of COVID and less risk, and doing this well and effectively and getting vaccine, not just to the most people, but into the settings that are driving COVID, the highest risk settings, the highest risk communities. That drops our rate rate of cases. It drops our risk related to these variants. And I am feeling hopeful right now that this summer will hopefully look different in many ways than last summer did. And I'm feeling good that by the fall or winter, we really will be starting to put these major impacts of COVID behind us, but hopefully still remembering kind of some of those lessons learned and being more prepared for whatever may come in the future.
Yeah, we absolutely know that rapidity is important, but we really can't have rapidity without equity, because that will just create more disparity. And we've already seen how certain communities have just borne the real brunt of this virus, and we can't perpetuate that in the dispensation of the vaccine. So we want rapidity, but we need the equity, and so that's how we'll really get everyone to the finish line together.
Sounds great. You give us reason to be hopeful. I'm going to wrap things up a little bit and ask you one final question. Are there any messages you'd like the viewers to take away from this discussion? So key things that you didn't mention earlier that you really think are important for people to know.
I think I would start with how, there are some basics that will have to be a very important part of getting towards the end of this that are beyond the vaccine. We have to continue our relationship with our masks. We have to continue to get tested, and we have to continue to cooperate with contact tracing. These are fundamentals that, in addition to vaccination, are very critical. And so I need to make sure that we continue to have the emphasis on those parts of the strategy as well.
Yeah, and I think I would just add that, I'm hopeful that people will recognize the really critical role that public health plays in terms of keeping all of us safe. And, historically, we've invested about $1 of every $100 that we spend in this country on things medical and public health on the public health side. And we really, it's best for everybody if we have systems that can talk to each other, if we have ways of keeping track of a lot of the preventive measures that help keep everybody healthy, and that if we work on a lot of these root causes that are driving the different ways this outbreak has shown up in Chicago and in Illinois, and really work on what do we value as a society. Like, that is how we will be stronger. In addition to rebuilding stockpiles and working on testing, I actually think being serious about how this outbreak has held up a mirror to the decisions we have made, like as a city, as a state, as a country, and hopefully making some different decisions in terms of how we support people who may not always have the loudest voices, but who tend to get hit hardest when a disease outbreak comes. So that's the hope, and I know both of us hope to really keep using some of the attention on public health, appreciate, awards like this that give us an opportunity to just come out of the shadows a little bit. We're not usually looking for the limelight, but I think on this particular issue, we've got it whether we like it or not, and using that opportunity to really say, what could we be doing differently to create a healthier society for everybody?
So I appreciate the way you're closing things out, because you focused on the immediate activities that people need to do, which is the public health measures, but also looking toward the future in terms of what else we need to do to create a more healthy environment in between pandemics so that we're stronger when there is another pandemic. So thank you so much for your comments today. I'd like to thank you for all that you've been doing for the state and for the city, congratulate you for your awards, and ask you to stay strong, because we still need you to keep working and fighting for us and protecting the state and the city. So thank you so much, and congratulations.
Thank you so much.
Wow. Thank you, Dr. Morita and Dr. Arwady and Dr. Ezike, for that very timely and important discussion. We appreciate your sharing your thoughtful remarks and candid insight. And thank you again to all our guests and sponsors for joining us today. Before we go, I'd be remiss if I did not recognize the Civic Federation's trustees, board of directors, and council members who have joined us today and whose support have made this event and the Civic Federation so successful. I'd also like to recognize the Civic Federation staff, especially Carol Frenda, Jay Hobart, Lorison Duncan, and Katie Broom, for their efforts in putting this program together. Stay tuned for more information on the slideshow immediately following my remarks, including information on how to support a local mission-driven small business by ordering commemorative face masks. On behalf of the Civic Federation and the Motorola Solutions Foundation, thank you all for joining us this morning to celebrate exceptional public service. This event is now adjourned.